to the causes of hair loss in women. These are the most common causes: telogen effluvium, and we'll talk about all of these in a little bit more detail. Telogen effluvium is shedding. Alopecia areata is spotty hair loss. Scarring alopecia is a fairly aggressive form of hair loss that causes permanent loss. Traction alopecia is lost due to specific hair care practices. And then androgenic alopecia, which is the genetic. There can be underlying medical problems as well, which can contribute. Telogen effluvium is the most common cause of temporary hair loss. It presents as diffuse shedding throughout the scalp. It's not focal in one particular area, but it's throughout. Most commonly, a woman will see hair shedding everywhere, in the sink, on their clothes, in the shower. It's usually temporary, only rarely can it be permanent. It can be caused by a long list of issues, including pregnancy, rapid weight loss, nutrient deficiencies, emotional stress, physical stress, surgery. Some medications can cause it, which is always a challenge. The good news is telogen effluvium is usually reversible, and regrowth can occur, and it takes about a full year for that to happen. Second diagnosis, alopecia areata. This is a form of an autoimmune disease, which means the body itself is causing the inflammation around the hair follicle, preventing it from growing. This most often presents as a circular, or what we call a coin-shaped lesion. As you can see in the pictures, the margins are really sharp. Less commonly, it can present like a telogen effluvium with excessive shedding and sort of more all over, but more commonly it is the circular lesions. Women with alopecia areata can also experience hair loss elsewhere, including eyelashes, eyebrows, and rarely it can progress to being the entire scalp and sometimes the entire body. Scarring alopecia is a fairly rare type of hair loss, but it's becoming more common. I'm not sure why that's happening. Oftentimes a woman will present with frontal hair loss. If we look closely at the hair follicle, we'll see inflammation, some scaling surrounding the follicle. This is probably the more common type that we see. It's called frontal fibrosing alopecia. Unfortunately, in this particular problem, the hair follicles are actually destroyed and disappear, so treatment early on is incredibly important. Traction alopecia is hair loss that occurs from pulling the hair too tightly, either in ponytails or buns, dreadlocks. Just harsh pulling on the frontal part of the hair will cause inflammation and damage to the hair follicle. Androgenic alopecia is the most common cause of hair thinning and loss in women. It's also known as female pattern hair loss. Up to 50% of women will have some degree of this in their lifetime. The diagram on the right sort of describes the extent to which we can see the hair loss. It often occurs most commonly later on in life, but I have seen women as young as 16 and 17% with genetic hair loss. Hormones play an important role in this. That's why in young women it's important for us to get a hormonal history. Sometimes hormone levels are drawn. This is a genetic cause of hair loss. Not everybody comes in saying, oh, I know, so-and-so in my family has had hair loss, but if we really dig a little deeper, we usually can find that it is indeed in the family. It's typically more common in the front or on the top of the head, and early on there can be some inflammation. There can also be some underlying medical problems which contribute to hair loss in women. Hormone imbalance, as I discussed before. Anemia, iron deficiency is one of the most common causes of excessive shedding. Some dietary and nutritional deficiencies, protein loss, poor diet, nutrient deficient diets can cause weak and thinning hair. We do know that there are some medications which can aggravate hair loss. This is always a challenge when we can't find any other cause for it, because certainly we don't want people to stop their medications that they're taking. There are some other skin disorders which can cause hair loss, including something like psoriasis, and severe seborrhea can cause a temporary shedding.